Today is December 7, 2021, and today is the 80th anniversary of the invasion of the Japanese on Pearl Harbor. And it's my honor and privilege today to interview Dr. Edward Shahady, who is a Navy veteran, and pretty soon we'll get into some of his thoughts and his experiences in the Navy in Vietnam. But first, this interview is done while Ed is in Delray Beach, Florida, and I, Dan Ostergaard, am in my home in Olathe, Kansas, in my home office. And it is a sequel. This interview is a sequel to one done by Dr. Bill Ventress with Ed Shahady in 1991, May of 1991. So we'll build on that a little bit, but because it's so old, most of what we'll do will be discussion of and great information of the multiple contributions Ed has made to the specialty, to global family medicine, and to the community at large. I've reviewed his CV, and of course it's much too long. Even the things that are where he had a major role, it's much too long to mention all them, but they're all in his curriculum vitae. But I want to read an intro as part of the introduction of Ed that I sent to the University of North Carolina Department of Family Medicine in 2019. In 2019, they honored Ed with an endowment of an Edward Shahady Resident Education Fund. And they were kind enough to contact me for some thoughts and some ideas about my knowledge of Ed and his contributions. So I wrote them this. Thanks so much for asking me to share a little about my friend and colleague, Dr. Ed Shahady, whom I also consider one of my heroes in family medicine, in life in general. So it's my honor to continue the association with you, Ed, today with this interview of your contributions across your lifetime, basically. And with respect to Bill Ventress's interview of May 1991, please do, though, start with a little bit about your growing up in West Virginia and take us through med school and up to your time that you did the rotating internship at Akron City Hospital.
Well, thank you, Dan. And it's a pleasure to be on with you. Consider you one of my oldest and dearest friends. We've been through much together, and I appreciate all the help you've given me over the years. Excuse me. Well, I grew up in West Virginia, a small town called Fairmont, West Virginia. And I went to a school called St. Peter's High School, but I went through grade school all the way through high school and was taught by nuns. So Catholic education was strong for me. And growing up in a small town was strong. My father ran a fruit market, and that meant that we worked at the fruit market whether we wanted to or not. But I learned a lot about interacting with people. I learned something, the customer's always right. And I think I had to teach that to residents and students because many times they get upset with patients. And I recalled to them, remember, it's the patient and their disease and their problem, not yours. So that's what I took away from much of my young years. I went to a Jesuit university, college, and being taught mostly by Jesuit priests was a real honor. I think they taught me so many things besides the basics of chemistry, history, biology, etc. I think they taught me about understanding myself, understanding my relationship with the world, and I think formed the foundation of what I call Christian care as a physician. So that was very helpful to me. I went from Jesuit training to West Virginia University in Morgantown, and that was a real treat too because that was the second year of that medical school. Although the medical school before was part of maybe the 1930s, 1940s, this was a new medical school. They brought in some of the fantastic professors from the University of Minnesota. And I think I was very fortunate to have an excellent medical education. course, all along there, I got married. I got married in college to my beautiful wife, Sandra Shahady. We grew up together in Fairmont. We 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 had many children, and some of them very early in my career. So the children went through my medical education with me, as did my wife. Did my internship in Akron, Ohio, and that was a real treat because I don't know if you're aware of this, Dan, but the first president of the American Academy of General Practice was named Dr. Davis. His
Yes.
son was an orthopedist there. But anyways, he was from Akron. So general practice was well respected in Akron. That's one of the reasons I chose going to Akron and Akron City Hospital. So that was a real treat. After about in April of my internship, I already was signed up for residency in general practice. I got this nice letter from the United States government. Said, you have a choice, Mr. Shahady. I was no longer a doctor. You could go in as a medical officer, or you go in as a grunt, or as a regular guy. Of course, you always choose one as a physician, as a medical officer. I got my entry delayed for about a month and a half because Sandra was pregnant, and they allowed her to have the baby before I entered. I went to Camp Pendleton, California, and we drove all the way from Akron, nice long drive, with 3 kids, and one of them was a newborn. That was a real treat. The newborn was fine. It's the others that drove us crazy. The typical kids, typical parents trying to do our best. But it was a nice trip. I had no idea that I was going to be told as soon as I got there. They said, don't plant your winter corn. You're going to be in Vietnam in a couple months. So
Wow. So was that a shock? And was it a shock to Sandra with 3 kids, including an infant, and you'd be going away?
it shocked us both. I didn't know what to do. She was in tears because there we made arrangements to move entirely with everything we owned. My father was kind enough to buy us a new car, so we had that. We rented a place and we talked over what should she do. Now there were other people that we knew, other young physicians with their families. Their families, they weren't they were married but not children. So their wives went back to their hometown. But Sandra decided to stay. So she stayed with the kids in Oceanside, California. And I admire her so much for what she was able to do to take care of those kids and do all that. So I did a little bit of basic training. They taught me how to sleep on the ground, which was new to me. Taught me how to fire a gun, which I promptly gave up because I figured using that gun, it was very dangerous to me and anybody around me. So I said, if it comes time when guns are necessary, that's why I have all these Marines around. So
Well, you were the doctor as a Navy guy. You were the doctor for the Marines, right?
that's correct. I forgot to mention that. Although I was Navy, I was Semper Fi. To me, I thought I was in the Marines then, because there was another doctor who happened to be a classmate of mine, and who was the battalion surgeon with me, and the other Navy guy was the pastor, the minister, one a Baptist minister and the other one a Catholic priest, who were great people to be with, because I think compared to Marines, Marines are wonderful people, but they're there to do a different job than we were. So I learned
Ed,
about the Marines. I learned about military life. Scared to death my first 2 weeks in country. I got used to it after a while.
having talked to you about your time in Vietnam, and having seen the website that you set up about the children's hospital that you actually built there, you and the doctors and the priests, I understand how important I probably can't really understand, but I think I understand how important that experience in Vietnam was to your life trajectory in service after that. Talk a little bit about that experience and how it formed your life.
Well, thank you, Dan, because it really did. Uh, when we got there, the colonel and the rest of the administration said, please go out into the community, out into the villages and administer care. So we did that. We went out, and of course, all we had was some penicillin pills and some aspirin in a box. And of course, the Vietnamese people love seeing this. And if you looked at the website, Dan, you'll
I
see one
did.
of the pictures is me administering to the Vietnamese people. What I learned real quick was I couldn't do much for them with penicillin pills and my care. So, and we had a child that came in severely burned, and we couldn't do much for the child. We sent the child down to the Da Nang. They didn't want to take care of the child. So, and the child never came back. We presume the child died. So we went to the colonel, Colonel Dickey, wonderful guy. We said, Colonel, could we build a little hospital down here where we could bring the kids in and have them, at least give them IVs, give them food, give them penicillin pills? He said, yeah, now you got to put it on the periphery, and I'll give you Marine Guards down there. So that it took us, we went over to the CBs. We asked them to build a tent for us. Within 2 months, the initial 30 beds wasn't enough, and we were stuffing them in. We went to 45 to 50 beds. And that was what it was.
And of all of those beds, were most of them filled by Vietnamese, or were some of them filled by Americans?
No, all Vietnamese. It was nothing but it was a children's hospital. Of course, Americans were all adults. And if they were sick where they needed hospitalization, we would take them by ambulance to downtown Da Nang, where there was a sea medical company and a much larger facility to care for sick Marines.
How far was your hospital and your base from Da Nang?
20 miles north. We were on the border where the North Vietnamese were, called Hoa
Right.
Con,
Right.
HOA, capital KHANH, Hoa Con Village.
Okay, spell that website right now so we can get it and make sure the transcriptionist will get it later.
It's Hoa Con Children's Hospital, HOA, all one word, KHANH, children'shospital.com.
Great. Okay, keep talking. Fascinating.
Okay, well, we started the hospital, and initially the parents would drop the child off for a day and then come get the child because they didn't trust us, they didn't know us. And one of the things I did to try to help that was learn to speak Vietnamese. And I became known as Bác sĩ nói tiếng Việt Nam, doctor who speaks Vietnamese. Now, I didn't speak it very well, but we had two Vietnamese women that worked for us initially just as to feed the kids and speak to them. And then they became nurses. We taught them. But one of them was named Nguyen. And on the website, you can read about Nguyen. I taught her English. She taught me Vietnamese. And I just learned basic Vietnamese. Dao was pain, Dao was headache, Dao bone, abdominal pain. And I asked people, where are you hurting? And the other doctor didn't learn Vietnamese. So I became this doctor that spoke Vietnamese. And they'd come and they'd start rattling off to me, and I'd shut up, then look to win. So what do they say? But I could tell. I could say, does your belly hurt? Down, bone. I still know some of the language. Does your head hurt? Dow, dow. You like that accent, Dan?
Yeah, that's great. You're really good. I remember you spoke Spanglish too, but that's a whole nother story.
Oh, that's there you go. You and I both learned Spanglish. But
Ed,
I learned it. I learned the culture, and I learned the people, and it was real fun because to take care of, I think, someone, you have to know the culture. You and I know as family physicians, you not only know the disease, you know the person with the disease. So I learned about the Vietnamese, how they value their families, their history. Dan, if you were born in Vietnam, there's a 50% chance you'd be dead within a year from TB or another infectious disease. Well, we were able to cut that in half with just simple hygiene because we taught them how to wash. Nutrition was better. Although it was GI food, it was a lot better than what they had to eat. And we had those Vietnamese women who taught us the culture and how to take care of it. You know what that helped me with, Dan? How important culture is to caring for people. You and I know that we learned everywhere we went. You in Minnesota, in Kansas City, myself in Ohio and North Carolina and Florida. There's different culture everywhere. People have their own values. If you don't learn about those values, it's not just simply taking care of a pneumonia. It's a pneumonia in someone that lives in northeastern Ohio, or it's a pneumonia in a Vietnamese child with a Vietnamese culture. And you have to be aware of the culture to practice medicine. So I really learned that well in Vietnam.
You know, there's, as we have worked in our global health meetings here, a phrase that we have talked about is culture eats strategy for lunch. We'll never be culturally competent, but we have to be culturally aware. So, Ed, when you were in that jungle setting right south of the North Vietnamese border, did you see other weird stuff? I mean, not too weird, malaria, pneumonic plague, bubonic plague, things like that.
Absolutely. And of course, initially, we had about a 7 or 8-year-old come in, and she had a swelling in her groin. And we couldn't figure out what that was.
It's a
And
bubo.
yeah, little did I know that. Bugo, which in Greek means groin. I learned that later too, Dan. I don't know if you're aware of that, what bubo meant. I gave a talk on this later and I looked it all up. Didn't have the resources in Vietnam to look up all that stuff. But this child, he wasn't a child, he was about 13 years old, strapping young man came in, coughing up blood, died acutely. Couldn't figure it out. Went down to the village. And when we go down there, we talked to the priest. And the priest, he couldn't speak much English, but he said pestis. Boom, it made sense. Pasteurella pestis, which was the name of the organism at that time that caused plague. So we start putting 2 and 2 together. You could have an infectious disease doctor come up from Da Nang, and he showed us how to aspirate buboes to make the diagnosis. The corpsman was very good with microscopes. So we were making a diagnosis of bubonic plague right there, and there was plenty of it. Now they'd come in mainly not that sick. They would have nodules in their axilla, in their groin, and you know, those were the buboes, and they had a fever and they were lethargic. Of course, a couple of them died, the one boy that helped us make the diagnosis. So Dan, it was a real, I don't want to use the word treat, but to make a diagnosis of an unusual disease. Of course, we were just finished an internship. We were very cocky, and we found out we didn't know anything about, you know, those type of diseases, malaria, plague. We saw, I forget what you would see when somebody had a lesion on their face, but all kinds of unusual diseases, which didn't do us much good when we got back to the United States, except give unusual talks.
So when you went through these experiences and you became the doctor who speaks Vietnamese, and you obviously developed or continued development of your caring for people and their own setting, how did that inform your decision to go back and become a family physician? Because while you were there, you were a rotating intern, GMO, a general medical officer type person, and you went back and you went into what was then a possible general practice residency. But how did all that make the difference for you to go into family medicine?
Well, okay, Dan, when I was in Vietnam, I did primarily pediatrics. So I get back to Camp Pendleton and I wanted to stay there because my family was there and I figured we'd be there for a year and then go back to Akron. So when I got there, they put me in the general medical officer's clinic. Well, they, of course, you take care of children there too. They didn't, the pediatric clinic couldn't handle all the kids. So they saw that I was pretty good at handling kids. So the pediatricians came over to me within a month, said, you know, we're overwhelmed over here. Would you be willing to join us in the pediatric department? So I spent 11 months as a pediatrician, and that was fun. And because I had those, you know, all those, and there's a couple of them were super specialists who were just drafted like from Harvard, great people. And they taught me a lot of pediatrics. And I took what I learned in Vietnam on my own and coupled it with what they could teach me about pediatrics. I think I had the equivalent of a pediatric residency, at least a year to build on. So 2 years of pediatrics to go back to Akron to do one more year of general practice residency. And it was called GP residency then. And we didn't have a specialty of family medicine then, but it came pretty quick. And I was excited to get my boards in family medicine. I was one of the first groups that took family medicine boards. And then I was scared. I didn't know if I'd pass them, which I did fine. But, you know, scary. And because, of course, I took boards in medical school, but I hadn't taken anything since then. But it was a real honor to be one of the first to be a board certified family physician.
Absolutely. Yeah, you might have been a charter board member given those age times that you're talking about. But I know you did some practice, and I believe it was right after you finished that GP residency. But and tell us where that was. And then after that, as a very young guy, you went back and became program director of the brand new family practice residency, we called it then, at Akron City Hospital. Talk about that.
Oh yes, Dan. And that was well when I was at Akron before, I remembered a couple physicians that had a practice in Mogador, Ohio, which was about 15 miles outside of Akron. So I liked them. When I was there about 6 months in my residency, I asked them if they were interested, and they were. So I agreed to join them right out of residency. That was in Mogador, Ohio, about 10 or 15 miles outside of Akron, a rural area, a really fascinating area. A lot of Mennonite folks in that area, rural people. Uh, so that's where I started my practice. I did OB back then, Dan. In fact, I did OB until I came to Florida, which a lot of us did obstetrics then. So it was a lot of fun because if you do OB, you're going to do pediatrics. And my past history in pediatrics, I was able to take care of a lot of kids. In fact, a lot of physicians brought their children to me because of my experience in Vietnam. Of course, I'd give those talks and I'd show pictures of all those kids. And a lot of the pediatricians were asking me about the diseases because they'd never seen them either. You know, besides plague, you know, I saw other, you know, characteristic diseases of, you know, tropical areas. So that was that. And I spent about 2 years um, in Mogador, Ohio, with those two doctors. And then I was made chair of the committee to form a family practice residency. We had a general practice residency. So they wanted a family practice residency. So my job as chairman was to recommend someone to be the director. Well, the 3 or 4 people on the committee recommended me as the first director. So with my ego being what it was, I said, great, I'll do it. And they paid me fairly well. They paid me the same I was making, you know, out there in Mogador. So it was a good beginning. There were 2 residents, one third year and one second year. You may know one of my residents, Dave Hoff. Did you
Oh,
know Dave
sure.
Hoff from Akron? Yeah. Well,
Yeah,
he
he
was
became a
one of my
residency
first
director too.
residents. And he went into the service after, and he came back, was my first faculty member. So that was fun. Dan, he was really good. He was an excellent resident, excellent doctor. And
So Ed, that obviously put you in the academic environment. So as a teacher, administrator, leader, that began, I guess, your academic trajectory, which we'll spend a bit of time talking about now. After you were PD for I don't remember how many years, but then you went for a short stint to the University of Northeastern Ohio, and then on to your main focus and the beginning of your many years at UNC. Talk us through a little bit of that, and then we'll talk about your roles at University of North Carolina.
Okay, Dan, when I became the director in Akron City Hospital soon became part of Northeastern Ohio. So I just added the new title as chairman of the family practice group in Northeastern Ohio, which is about 4 or 5 hospitals. So the residency program was still Akron City Hospital's program, but I was considered department chairman at Northeastern Ohio. And it wasn't until a couple of years later that the Department of Family Medicine in Northeastern Ohio was formed. I never formally went over and took up space at Northeastern Ohio because originally they had a dean and a provost, and it took a while for them to form departments where the department chairman was over there. But we were during my time there, we helped develop a student center. The university and the state gave us money in Akron City and Akron General and Akron St. Thomas to build something for medical students. And that's where the students were going to come over. I just barely taught a little bit of there. By that time, I was recruited by North Carolina because, Dan, there were very few family practice residencies. I was in the first 20. So as a residency director with 5 years experience in 1975, I was unique, and that's why they came after me. I had no other academic experience, but they recruited me at UNC. They made me a full professor. Of course, your buddy, Tom Stern said to me, Ed, make sure you get a full professorship. Those other damn people won't respect you unless you're a full professor. So I had to negotiate with the dean. And Tom told me, put your foot down. I did. And they wanted me. So he made me a full professor. I didn't know what that meant, but I learned later what it meant.
Yeah, that's quite amazing for you to be a full professor without a whole, well, not now, it would be impossible without a whole bunch of scholarly work. But you had a bunch of talks, and you obviously talked about and lectured about and were academic about your time in Vietnam and all these things you saw. So maybe it isn't quite as unusual, but Tom Stern was absolutely right at that time to be a full professor. Now, was there a department there before? And if so, who started it? I can't remember that.
A department where? In North Carolina?
Yeah.
Absolutely. Bob Smith came from England to be the first chairman. I don't know if you remember him.
Okay,
yeah,
so
was
you
the first chairman.
You took over from him and then stayed for many, many years.
I stayed there. I stayed chairman for 10 years, and I'd stayed another 9 years as a full professor.
Okay, let's talk about a few other things you did there, if that's okay. And I'm going to go back to something that I mentioned at the intro, and that is the letter I sent to the University of North Carolina when they were honoring you with that endowed residency education fund 2 years ago. One of the things I said to them was, at about the time you became chair there, and early in your time as chair at UNC, you and my mentor, the late Dr. Tom Stern, as well as others, traveled the country with SOTs. We were not SOTs, but we taught symposia on teaching skills. And even though I was a young kid, I was part of that team and enjoyed it. And we would do seminars for the practicing docs on teaching techniques. And these practicing docs became faculty all over the country. And I can't believe I did this, but I sometimes introduced you as the mouth from the South. Did I really do that?
Yeah, you were very good at that. That was a term of endearment
That's right.
that you would say about
So
me.
tell us about some of those things you did for the American Academy while you were the dean, the chair at UNC, like the
Well, it
Sox.
started, Dan, when I was in Akron, because I would go, to the yearly thing that the academy put on for directors of family practice programs. And I think after the first year, I think Tom invited me to speak. So I spoke at many of them. That's where I think that people from North Carolina became familiar with me. They heard me speak. And we were speaking about, how do you start a family practice residency? How do you maintain it? What are some of the things you do for teaching skills? So I was part of the faculty of the AAFP's residency directors program for quite some time in Akron as well as in North Carolina. So that was a lot of fun. That's where I got to meet you, along with Tom Stern. I think you were Tom's, you were his valet, I believe.
I
You took care of him. Good.
hope I was more than his valet. I hope we were alter egos, although he had a very stern visage and I tried to smile. Well, he didn't, but I guess I was his alter ego. From that time, I have another anecdote that I wrote that I sent to UNC. I said, I'll read it. I think it was in 1977 when Ed recognized the potential of a skinny UNC med student named Doug Henley and sent him to the AAFP State Officers Conference in Kansas City. This skinny student wearing a bow tie looked me up because Dr. Shahady told him to do so. Ed always encouraged and inspired students and residents in all of his roles. And that is one of your lasting legacies.
Well, thank you for saying that, Dan. And Doug, I inspired some students in Akron, but didn't have the exposure. Once I got to North Carolina, I had a lot of students exposure because they rotated. And Doug Henley's father, who was a pharmacist, was the primary mover to get UNC to have family medicine. And he, in fact, when I got there, we didn't have very nice facilities, and I asked him to help me get facilities. It took quite some time, over 10 years, but we finally built a $7 million building to house family medicine. I realized that was maybe 20 years ago. So that much money into a building was a beautiful 21,000 square foot building with administrative site and a clinical site, just a state of the art everything. So his dad was very important. Now, I learned that real quick. There was a guy named Archie Johnson. I don't know if you recall that name. Archie unfortunately had a death, premature death, very early in his life. But he was a big help. He was the link to the North Carolina Academy. He was the link to so many people, and he helped me tremendously because he knew the politics, he knew the people, and he and Doug, I think, in getting me introduced to the North Carolina Academy, got me introduced to the legislature. Of course, as an academic, you're not supposed to do that, and the dean reminded me of that several times. But Doug and other people with the academy would bring over legislators, and we would talk to them and tell them why we needed a new building. And we finally got that new building after I was there 10 years, but it took that much time. But Doug Henley was instrumental in that because Doug was not only a medical student and a resident in our program, he was president of the North Carolina Academy. So he was a And what a friend, what a powerhouse. He was also an outstanding resident. He was the chief resident. People used to say I treated him too good because I allowed him to go to all those meetings. But I figured it was really important that he become familiar with the American Academy, and the rest is history.
The rest is
He
history.
became involved in the American Academy.
Let me go to another paragraph I sent to the UNC committee in 2019. But before I do that, I need to make an observation about what I said a moment ago. That is about your lasting legacy, one of them being nurturing residents and students. As I read the hundreds of, I didn't read the articles, but as I looked through the CV and saw the hundreds of articles and chapters and books you'd written, I noticed that a lot of those articles were co-written with med students. And again, I think that for you was an incredible thing about nurturing med students when you were the academic chief, and you saw a spark in them like you did with Doug Henley. Just a comment.
Yes, Dan. I tell you, it was when I was in North Carolina, it was with residents and faculty that I co-wrote articles. With medical students, we haven't talked about this yet, but I'll introduce it. When I was in Florida State University in Tallahassee, the unique thing about being a faculty member there is you did mostly first and second year students. So I taught them in a classroom setting. And so they would want to, they would talk to me a lot. We would see them. It was different than a resident. And one of the things that I did with them, because they would come to me, and they knew I was interested in sports medicine. Many of them would come to me with their injuries. And I said, why don't we publish this? What do you mean? Well, I'll help you write about your hand, about your foot, about your shoulder, how it happened, what we need to do. And of course, I ran an elective on sports medicine, which a lot of them came to. So it was a great way to teach sports medicine because I knew about their injury. So I could teach them why is the history important, why is the physical important, and what about the literature. And you know about this because you had the problem. So they loved it, and I loved doing that with them.
Well, the paragraph I'm about to read transcends your time in Carolina and your multiple times in Florida. So I'll read it. Dr. Shahady was a major North American leader of the ICFM, the International Center of Family Medicine, which was the entity that organized the development of family medicine in Central and South America during the 80s. He and I traveled together to several of those countries, along with others, where he somewhat proudly and sometimes sheepishly tried to speak Spanglish. And then, nearly 20 years ago now, Ed was among the very small group of family medicine leaders with global health educational experience who developed what is now the AFP Center of Global Health Initiatives. As it was created and grew, the AFP Global Health Workshop, he threatened to kiss me on the cheek. He was the program director. The content director of the project and the program. Chris kissed me on the cheek publicly when we exceeded 300 attendees at the Global Health Workshop. When we breached that threshold, I was nowhere in the room and nowhere near you.
Not true, not true.
Oh,
I came to the head of the table and threw a kiss on your cheek, and you ran away.
I guess that is.
I don't know who your assistant was at that time, but I think she can confirm that.
I think you're
Is that
right.
Pam Williams?
Well, she was, at that time, I can't even remember. I think it was Diane McDaniel, but Pam Williams was a great helper in everything. But let's go back now to a little bit more to UNC because that was the main focus. And then we can move on to Florida a little bit. What else can you tell us about your time there? Obviously, it was huge building the building, and you learned and you help students as we've talked about. Anything else you'd like to say about that, or should we move on to?
Dan, do you want to go over some of the have we done enough internationally, or will you come back to that?
Actually, I'm coming back to that because I want to talk about you being a Lebanese American, about all of your work back in Lebanon. So we'll come back to some international stuff, okay?
Okay. Okay. What do we want to talk about now?
Anything more about UNC? That's where you were the longest time as chair, and
Right.
then on as you left, as you stepped down to the chair, you were there for a long time after that.
Yeah. Well, one of the things, Dan, that I learned when I got there, the chairman before me was from England, and he didn't relate that well to the family physicians in the state. So it was made clear to me when I got there, we need someone that appreciates how practicing family physicians relate to the department. And of course, that was easy for me because in Akron, that was absolutely, we related to the practicing family docs. They came in and precepted for us. Uh, I went out to their offices. So we also uniquely at UNC, Dan, had other residencies besides the one in Chapel Hill. We had them in Charlotte, North Carolina, Greensboro, and then we created another one in Asheville, North Carolina. And some great people who helped us begin those programs and strengthen those programs. Dave Citron, George Wolf, other people, they were leaders in the state and they were running those residencies. So it's very important that as part of my job, and it was clear, was go visit those residencies once a month. And I would precept, but I would talk to the director and the residents because there wasn't a feeling that they were part of the UNC system. So I helped create that feeling they were part of the system. We also, with the aid of Dave Citron from Charlotte, uh, developed something in Wild Acres, North Carolina, which was a beautiful retreat center that would go once a year with all the faculty that could make it. And we would go on Friday, stay all day Saturday and Sunday morning. And we would do academic exercises, discuss family medicine, and then build our relationships with each other. We had something called the ACC. I know there's an ACC basketball and football, but ours was the ACC, the Affiliated Coordinated Consortium. I created that name along with a couple other people to get us because I wanted people to relate to each other. And we would always bring faculty from the outside residencies into Chapel Hill at least once a year to teach and meet with us. So it was an excellent relationship. And that didn't exist before. But I think it was clear when I went there, that's what they wanted. They wanted the programs to relate to each other and be part of each other.
And in that world of the development of our specialty, there was another school there. You mentioned the ACC as the sports entity. Did you have any dealings with Duke or any of the other entities, or wasn't there much cross pollination? I mean, you were UNC. Asheville was Asheville UNC. Was it all of your work was UNC, obviously?
Well, Dan, absolutely. The relationship with Duke and Wake Forest, and also East Carolina. East Carolina, Jim Jones, who you know well, outstanding family physician. Well, before he went there, he came up and talked to me, and we bonded with each other, and I tried to be a big help. In fact, Jim had a nice little trailer down at the beach, and he allowed me to go down there with my kids, and we could go fishing down there. So Jim was a good friend. He still is a good friend uh, all these years. Over at Duke was Terry Kane, another good friend. So I didn't know anything about the antagonism between Carolina and Duke because I knew Terry. He was a good friend, so we related to each other. We played a softball game yearly against each other. We had a keg of beer for the winter, so I related to Terry very well and to the faculty over there. Block on the guy that was chairman over there, but we related well. Wake Forest was not as close because it was a little bit more distance, but Duke was only 11 miles away. So I could go over there and teach. They would come over and teach in our program. So I think we have a lot of good relationships because remember, I haven't brought it up yet, AHEC, Area Health Education Center, they provided a lot of the funding for family practice. In fact, I think we had a $30 million budget over 5 years to help family practice programs. So it was important to them, and I was told when I was recruited, please get your relationships with Duke and Wake Forest and ECU. So
Well, that's wonderful. And I thought that was the case. Therefore, from the academic ACC, there were better relationships than between Duke and Carolina in the basketball ACC, it sounds like, because as I know from the now mentioned Doug Henley, he calls Duke, D-O-O-K.
yeah, yeah, the Dokies, we call them. And they have
So,
names for us too.
Ed, I want to go back to the global health stuff, which is so important to both of us. But before that, I want to talk about some of your leadership roles beyond that at UNC. I don't think anybody realizes that you were president of SDFM and also the interim executive director at the time that the extant executive director of SDFM left. How did you do both?
Well, Dan, there was an unfortunate incident where we had to part ways with the executive director. And one of the first things I did the first week that I was president, I went to SDFM and I interviewed everybody. I became familiar with what the problems were. There were some significant administrative deficiencies. So I decided that that was my highest priority for that year, was straighten those things out. I didn't want to go hire an executive director when I didn't even know what the job was. So we had to let the executive director go, and I had to work with the other people, and I had to make it clear. And there were some policies, financial policies that weren't good. Dan, we borrowed $30,000. That's back in 1980. Right as I was coming in as president. That's a hell of a debt. I paid it off within the year, but it scared me to death. Going to have that debt. So I said, they were all ladies. We've got to get ourselves on financial good footing. We did. We did. And the one way I did it was add more workshops. We were going for one annual meeting. We added some other workshops, a practice management workshop, a sports medicine workshop, and those were income producing. And they also brought more people into the fold for wanting to be part of the membership. I think we almost doubled our membership because of the meetings we were having. Now, towards the latter part of my presidency, we said, well, let's get an executive director. And that's when we began looking. And that's when I had the great honor and privilege of meeting Roger Sherwood. And I was really impressed with Roger. And thank God he agreed to come on. He was head of a fraternity, not a group of people, the administrative organization of a fraternity. I blocked the name, but he had a lot of experience in running organizations with people in academic settings. Said, you know how we are, Dan. Dan, we know how we are, Roger. We've got big egos. Can you handle that? He says, I'm used to it. And he proved it right off the bat. He knew how to handle us. He got us on good financial backing. And he even found some money because, as I said, we had some unfortunate happening with our finances. And he found out a way to get it back. That we actually had insurance to cover for that. So Roger was a godsend.
I totally agree because I was around at that time or showed up at the academy for a second time about that time. And Roger was a godsend, and unknown to you, he's still a godsend. He works as a volunteer for the Center of the History of Family Medicine, and this interview is for the Center for the History of Family Medicine, the manager of which is Crystal Bauer. And he will review this oral history, because Crystal sends all the oral histories to Roger to review. He's still very, very active. Now he might dispute some of what we're saying, but he probably knows the truth too.
He knows the truth. If it wasn't for him, we wouldn't have done what we did.
Right. Now, again, I know you don't want to blow your own horn, but just in terms of SDFM, you were everything SDFM. You were the president, you were the executive director, you were the president of the SDFM Foundation, you were a recipient of the Marion Bishop Fellowship Award. Well, I don't think there are any other honors.
Fellowship, it was the Marion Bishop Award.
Oh, yeah, it was fellowship was different. It was the Marion Bishop Award. Well, and I think you got the award from our dear departed guy from California, whose name escapes me, so we'll have to come up with that for the transcript. At any rate, beyond SDFM, you were involved in the other organizations. Were you ever president of the Association of Departments of Family Medicine?
No, I wasn't.
But you were a member.
Not president.
You were part of that, but not a president. Let's name some people and see what your reaction is to the name. Just give me 30 or 60 seconds. Actually, on my list, we're both Doug Henley and Roger Sherwood, so we don't need to talk about them. But Jim Jones.
Great supporter of family medicine in North Carolina. Great friend. Also lent me his house to go fishing in with my children.
Bob Graham.
Bob Graham was a giant, and I remember him as secretary of the Society of Teachers. And then, of course, at his later roles, I admire him for what he did for family medicine.
Well, and he's still doing it. We have the good fortune to see he and Jane frequently. But to clarify what you just said, the reason he was probably the first administrator type of the Society of Teachers of Family Medicine is that he was on the AAFP education staff at that time. And as such, the AAFP loaned him to the SDFM to be as an administrator, or whatever he was called then, secretary, to help get it going. So that was his role there, and agreed, he was a giant. What about...
I mentioned this, Dan. The Academy paid for that. I don't know if you're aware of that. The Academy paid for him because we were poor. And that's one of the things I wanted to change. I said, let's become fiscally responsible. And I feel during my year as president of SDFM, that changed. And I think because we became more income productive by having more meetings, because we were just relying on dues in one meeting and it wasn't enough. So we changed that. And if you will note, simple little things that SDFM didn't do back then, but they do now. They sell a lot of things. And for any business, you got to have multiple sources of income. My father ran a market. He taught me how to run that business because he didn't know if I'd make it in medical school. And I learned that there were various ways that you can make a buck. And I initiated those in SDFM. And then when Roger came in, I said to Roger, show me how you're going to do this. This is one of your responsibilities. And Roger continued that and made it better. The SDFM got on a strong financial footing.
Tom Stern.
Well, first of all, Tom sort of had that mean look to him. But what a big heart. You were with him a lot. And to me, he was family medicine. He represented the best of family medicine. If I thought of family medicine back in those days, I thought of Tom Stern and what he did.
Well, he also personified family medicine in the TV show of our early days called Marcus Welby. He was the
Yes.
medical consultant of Marcus Welby, MD. What about a non-MD, another non-MD in our past, Marion Bishop?
Marion Bishop, of course, I knew Marion Bishop a long time, on the SCFM board. I bet you probably 10 years with her on the board. She followed me as president, and of course, I was past president. Marion was unique in two ways. One is as a woman, and the other is a non-physician. Now, she had a lot of ugliness towards her that was indirect, and she had to overcome it, and she knew it. But she was the first woman to be president of SVFM and the first non-physician. And she was so good at it, so good, you wouldn't know there was a difference. She understood it because she'd been in academic administration with physicians for a long, long time. So great lady, great leader. So sad that she had to leave us so early in her life.
Yeah, we have wonderful, wonderful leaders, predecessors, colleagues in our specialty, and it makes it very, very rich. The international stuff, as you know, is near and dear to my heart, and I know it is to yours. I'm so glad you talked about Vietnam and how that formed you in terms of family medicine, in terms of rural health, in terms of global health interest. Um, Talk a little bit about the International Center of Family Medicine and your role there.
Well, let me first start off when I got really interested in international family medicine. My role before was in medicine in another country. International family medicine I got interested in when I was president of SVFM. Julio Zeitlin, who was from Argentina, and at that time he was, I think, in Venezuela, and I forget the name of the organization there that represented medicine in the area.
He was in Caracas as a leader, maybe the executive director of the Pan American Federation of Medical School Associations.
Yes. He was the director of that, and he came to Kansas City. I met with him. He wanted some involvement of SDFM in what he was doing. He was trying to get family medicine started in Latin America. So he invited me to come and be a consultant. I did that. And he was still in Venezuela at the time, but Argentina was a big part of that. He eventually moved to Argentina. They started the first residency in family practice. They had general practice residencies before that. But Julio was a real leader. I spent many years consulting with him. And then, of course, there was the International Center of Family Medicine. There was a board, and you were on that board, Dan, with me.
Well, about that board, you were on that board longer than I, and you were the vice president and had other roles. But you, well, I guess all of us had a rule that the president of the International Center of Family Medicine must be one of our colleagues from below the Rio Grande River. So the president was always Julio or Felix Gruber or somebody else from that part of the world, because it wasn't right. I mean, we were very happy to answer their questions and do what they needed, what they thought they needed done, not just what we thought they needed done, but what they thought they needed done, and help them. But they had to be the leaders. And now that is a booming enterprise, as not only it's ICFM / the Ibero-Americana region of the World Organization of Family Doctors. So Ed, again, with your leadership back then, there is a global impact of your work and your interest in people of other cultures.
Yeah, well, Julio was the driver behind that. And of course, he got me involved in their board. And I can remember key people that were presidents, like Tommy Owens was a president. The gentleman from Canada, who was part of the Canadian Society of Family Medicine, was present. Also, the president from Portugal, I'm blocking on his name. So we had an eclectic group of leaders who were part of it, and we'd have a meeting every year in one of those places. I can remember the first meeting was held in Puerto Rico, and International Center for Family Medicine in Puerto Rico, and the Puerto Ricans, of course, were probably proud of that. Jerry Stubbe, you remember Jerry? Jerry's now in the United States, I think in Virginia. So a lot of good memories and a lot of good people. And now it's a thriving organization and involves a lot of people, and it's been there for what, 20 years now?
Well, no, it's more than that. Well, no, it's probably about that. But you mentioned that first meeting in Puerto Rico. Well, that was kind of an enigma, and still is, because Puerto Rico is part of the United States of America, but Puerto Rico also is Spanish speaking and part of Ibero-Americana, if you will. So they're active in both cases, and I do well remember Jerry Stubbe. I'd like to see him again. Let's go now. Any more on ICFM? Because I want to talk about Lebanon.
Okay.
Well, knowing you are Lebanese American and a Lebanese Christian Roman Catholic, I was very interested to be reminded going through your CV that you made multiple consulting trips to Beirut to the American University. And talk about that, and talk about what you did there to help establish family medicine, and maybe some of the awards you've gotten in your Lebanese background and Lebanese connection, and what were some of the obstacles?
Well, I think I was invited several times to be a consultant to speak at their annual meeting. I think I can't take any credit for getting them going. I think they're pretty sophisticated in what they do. They've got a history. They're having challenges right now at this very time, but they've had a strong Lebanese family medicine organization over there for quite some time. They've taught general practice and then family medicine for quite some time, and they've had some great leaders. I think I was invited over as a consultant. I don't know how much I led them as much as consulted with them and offered them my thoughts about what they were doing. And Vince Hunt did a lot of that too. Vince, of course, you remember his involvement with Bahrain. So that, because of the geographic proximity, he did some things with Lebanon too. So I think the fact I was Lebanese, I was involved in family medicine, it made it easy for us to relate to each other. Now, as far as religion, Lebanon is primarily a Christian country. It's like 55% Christian. But the Muslims and the Christians get along very well. I've met many Muslim family physicians, many Christian family physicians. And I asked them bluntly one time, how do you get along? Says, no problem. We take care of patients. That's our number one job.
So you're saying you got along well in the professional role of physicians, whereas in the broader community, obviously, they don't get along quite so well between the Christians and the Muslim minority, right?
Well, I never saw that. I read about it, Dan, but I never saw it.
Wow, that's very interesting. Okay, so you also were part of the, as I mentioned earlier, the creation of what now we call the global health, the global health interest group of the AAFP. You were part of the creation of that, and as a RAP consultant, a residency assistance program consultant, you traveled all over, and it seems to me that in terms of the international part of those consultations, one time you had a very difficult assignment of going to the Bahamas. Do you remember that?
Very well. Want me to talk
Was
about
that?
that?
Well, sure. I mean, how did you get such a plum assignment as going to the Bahamas instead
Well,
of
I
Grand?
don't know who was making the assignments, whether it was you or somebody else, Dan. But that was at a point that I don't know how many people were traveling or willing to travel, and I was known for being willing to get on an airplane and go. And that was a very, very interesting consultation. The Bahamas, their system is based on what goes on in England.
Right.
It's not based on the American system, but they had a goal, and they wanted to make it so graduates for their program could sit for the American Board of Family Medicine. So that was their goal when they brought me over. They didn't make that too well known when they asked for the consultation, but they made it known as soon as I walked into the door. And of course, I said, I don't have any authority to tell you one way or the other. I can tell you what the story is now. If you want to do that, you got to do all the rules and regulations of what the American Board of Family Medicine, now states. They never did that because they knew they couldn't. But other things that I was able to accomplish with them, to give them suggestions about how to change their educational system, how to teach residents, some of the things that we did in the United States. And then I think that we were able to get not a wrap consultation, but some of the information that RAP hands out to them, which helped them. I stayed in touch with them for 2 or 3 years, and I would see them at academy meetings. And I think they were taking advantage of our knowledge. They could never become part of our system, but they copied many of our parts of our system.
Yeah, they did. And I'm so glad that you were an example of people who kept the communication going after you did that consultative activity, because that's what we now kind of call sustainability, that the contact continues, and if asked, the nurturing continues. Let's move to some more of your domestic accomplishments. I know you've written several books, and I know you've written at least one on sports medicine because I have it, but you also wrote one on retirement. Tell us about your books. And while you're thinking about your books, remember to look around your library at home and let us know if you have books, and then Crystal too. Let Crystal know if you have books that you have written that we don't have in the Center for the History of Family Medicine library.
Okay, would Crystal know what books are there?
She'll have to look that up, I'm sure. But
Okay, well, I'll
tell
tell
us
you what
about
I
your books.
have. You'll look what you have, and then we could meet in between, okay?
Yeah. So what
Okay,
tell
I'm
us
losing my
about some
train
of the
of thought.
books.
What was I going to say? What were you asking me
Well,
about my
I'm
books?
interested specifically about the one the Academy published for you on retirement. I remember going to at the assembly now called FMX, talks you did with Dr. Bob Higgins on retirement, and it became a book. How did that come about?
Well, I was asked, along with Bob Higgins, to do a seminar on retirement. And I think the reason was I'd given some talks on retirement because I was entering retirement. And as we gave this talk, I think I was asked by the Academy, and I'm blocking on the name of the person who was in the administrative responsibility at that time, said, Ed, why don't you write a book? I says, can I get help from the Academy? Said, absolutely. And I got help from one of the members of the staff, which I'm blocking on her name now, Phyllis.
Oh, Phyllis Nolan?
Yes, she
Yeah.
helped me. And what we did was we did multiple interviews, and we got a lot of pearls from retired physicians. And then we also we interviewed women physicians and what their issues were, because women have a unique set of issues. Because they're not only being a doctor, but they're caring for a family. And I got some great advice from them. We got advice from other people. other physicians. And if you ever look at the book, and it's online now, just go AAFP retirement and you find it. There's a lot of simple advice on what to do in retirement and by these physicians. They were great sources of information.
Well, your academic books from several publishers on sports medicine are also very helpful. And I know you had an interest in sports medicine. You mentioned that specifically during your Florida time at Florida State. And I guess you were doing that well prior to that. Do you remember the specific focus of any of those sports medicine books? Because I do want to have that in the transcript, at least, that you have several sports medicine books.
Well, first of all, Dan, let me tell you how I got interested in sports medicine. I go out to a ball game, and there my kids are playing. Somebody gets hurt, and my son says, "My dad's a doctor." So they get me out of the stands. Pretty soon, I was on the sideline. So I was a team doctor in Chapel Hill for 20 years and knew a lot of those athletes. Many of them went on to become, college players. So that got my interest in sports medicine. And of course, I would bring the residents out with me. Residents would take an elective. I ran a sports medicine clinic at the residency at Chapel Hill, and I would take them out at the ball games, and that's the best way for them to learn. So I practiced sports medicine in a clinic at the residency programs where I was, both in North Carolina and in Miami. And then when I was in Tallahassee, excuse me, I'm gonna take a swig here. That was straight Coke, nothing else. I think it was a lot of fun and got to meet when I would go to a school. I know when I was in Tallahassee, there was a Baptist school, and I got to meet the preacher and the principal, and I became part of that school and part of those people. And of course, I now got to know the kids and their families. So it was a great development for me.
Well, Ed, we're going to run out of time before too long, but a huge part of your retirement, sort of, if you actually ever did really retire, was your work in diabetes. And I know you did several things with the Diabetes Association. You used to ride bikes and ask people like me for donations to the ADA, which we were happy to do. And you were a diabetes master in the Diabetes Master Clinician program. And you started something like that in Florida, if I remember. Tell us about all of your work with diabetes, and remembering back to the talks you did at Assembly and FMX, you always did diabetes, you did chronic kidney disease, lipids, and everything that relates to all of us who have the metabolic syndrome. So go back to this diabetes work, which I don't think people really know about when they're thinking about Ed Shahady.
Well, thank you, Dan. I'm very proud of that. And in link with the diabetes was lipids. I am board certified in lipidology. You take a test for that. You've got to take so much education, take a test and pass the test. I was fortunate and passed the test. Barely, but that's all you got to do is barely. Because you're in competition with a lot of sharp people in diabetes and lipids. So I became very interested in that. But the interest started with diabetes. As you well know, people that are diabetic have lipid abnormalities. So for the Florida Academy of Family Physicians, we formed the Diabetes Master Clinician Program, which was to educate family physicians in Florida about the care of diabetes and automatically the care of lipids. So I would, at Academy meetings, statewide and nationally, talk about this. I would be invited to go places and help physicians and communities deal with this because it was a frustration. And I prided myself at getting it down to understandable. And understandable issue where you could take care of it and know how to handle people. Because everybody that's got diabetes is going to have metabolic syndrome, and many times they have severe lipid problems. And as you well know, with lipid problems, you can put them on a statin, and they don't always can't take it. So what are the alternatives? So I think I learned with time to help physicians treat lipid abnormalities, metabolic syndrome, diabetes. And I had about 150 physicians who were part of this program where all their diabetic patients would be entered into a database. And at any time, they could look and see which patients weren't at goal. We knew how many of their patients were at goal at LDL. They could go click, and here were 50 patients that weren't at goal. And I would help them create plans to get those patients at goal.
Wow. Getting to goal in terms of all of those functions, I guess, glucose control, renal function control, lipid control. Is that still going on?
Absolutely, it still goes on. And how it goes on now, I'm not as active as because they have lost interest. But what they know right now, they can look if they keep their database up to date. If you have 200 diabetic patients, and we know the goal for LDL is, say, it was 100, now it's 70, they could look at how many of their patients are in the goal by clicking, and they'll have their record, and they can decide, do I want to do something about it? Because one of the major issues is patients quit coming in. Dan, you and I, as family physicians, don't have a memory of every patient and whether they've come in or not. A registry, which we had for them, tells you. They could look on there, see which patients had been in the last 6 months, look at people who were gold, and it had contact information. Well, here was Ed Shahady. He wasn't a goal for LDL. Here's his contact information. And they also had a staff person who's responsible for following up.
The individual,
Okay.
the individual family doc had a staff person that for following up.
Right. You know, one of my medical assistants would do that.
Right. Was that a function of the Florida Academy?
Initially, it was, yes. And then the Florida Academy no longer wanted to do it. And they said, you can do it. I was able to get some grants from Blue Cross Blue Shield and continue it. Those grants are almost finished now.
Well, and as you told me that you're not going on the road much, so you're not going, it's got to be online if at this point. Well, I hope it keeps going because as I've watched you do that over all these years of so-called retirement, it looks like it's been a really great service. So too bad if it doesn't continue with grants or whatever it takes to support it.
Well, Dan, if I had the energy, I would. You know, 83, and you slow down a little bit, I don't have the energy.
No, I understand that. Well, let me ask you to think back on what we've just talked about and see what I have forgotten to ask you, but that you think we should talk about, because this is your interview. Let's get everything out that Ed Shahady wants on this oral history.
Well, let me just mention one thing about teaching. That over the last year, I went to a residency program in South Florida, run by one of my former residents, and I would give a lecture in the morning. I'd go there once a month, give a lecture in the morning, and then run a sports medicine clinic in the afternoon. And that was the last time that I was involved with residents. I had to stop it about 6 months ago because the energy decreased. I just didn't have the energy anymore. But that was my last involvement, and that was a lot of fun to be with residents again, teach them. And I'd love to. I'd get an hour and a half for the lecture, and I could do hands-on teaching. And then I'd go to a sports medicine clinic and I would get a third-year resident who was excited, and I'd teach him how to inject knees, inject shoulders. So that was my last hurrah. So at 82 years old, I did it up to age 82, where I was able to do it. So I wanted to mention that. I think my involvement with the academy teaching ended a couple years ago. That's when I said to myself at age 80, I should stop lecturing. Now the staff said there's no evidence that you should stop. But I felt that an 80-year-old, I was seeing patients partially, but not like a practicing doctor. And I thought it was time to stop. So right
Well,
now, while I'm doing, that you're helping me remember a lot of stuff about practicing medicine, and I appreciate that.
well, you have done an incredibly good job. Your legacy is clear in so many ways, particularly in international family medicine and your work with students as per the UNC endowment that will take you through with residents, well, forever. Um, so thank you so much, Ed, for agreeing to do this interview. Thank you for all you've done over all those years. Thank you for hanging in there until your early 80s or mid 80s, I guess I might say. And therefore, for the end of this interview, this has been with Edward Shahady, MD, of Florida, of Ohio, of North Carolina, of Camp Pendleton, and of Vietnam. And I'm sure there are other places too. Thanks so much, Ed, and best
Thank you,
wishes for a
Dan.
long life.
Thank you. Same to you, buddy.